Good morning, everyone. Welcome to our second session of this program called as Back on Track. Hope you all remember the exercises that we did for our first session, which was most of a mobility as well as diaphragmatic breathing. Okay, today the session is going to be more focused on something called as posterior chain. Now, when it comes to low back pain, we generally feel that strengthening your core is all that it takes, but no, there is something called as posterior chain, the chain of muscles that we have at back of our the whole lower limb, that is called as glutes, which includes muscles like glute maximus, medius, minimus. We have our hamstring muscles, okay? We have our calf muscles. Now, these all muscles play a very important role in maintaining your stability at your pelvic region as well as your hip mobility and hip strength, which in turns helps to strengthen and reduce the low back pain. Okay, so in today's session, let's quickly start with our warm up. We're going to do 3 exercises for the warm up and then further move ahead of the session. Okay, so starting with our warm up, the first exercise that we are going to do is called as a child's pose to a cobra pose transition exercise. Okay, so this is going to again a bit of mobility work so that we get good start for our session today. Okay, for this exercise I want you to go in the quadruped position. I think you all remember what we did for the quadruped position. I'm just quickly going to recap that. So shoulders and wrist under the same line, your hips and knees under the same line, equally distribute the weight, maintain a neutral spine initially, and then the starting of the exercise, I want you to try and touch your buttocks on the heels. Stretch, stretch your hand completely. Feel the stretch in your low back as well as your lats muscles. Now raise up and go into the cobra position. Look up and breathe out. Let's do 2 sets of this and 8 reps. 2, 3, stretch and look up. 5. Good job. Keep moving. Get that mobility there, okay? Keep moving. And look up and breathe out. Let's go ahead. Do not hold your breath. And up. 1 more rep to go. And breathe out there. As this is the first exercise, and if you have just woke up and joined the session, you might feel there's some cramping or a bit of pain, and that's fine because you've just started moving. Let's move with the second set, 8 reps. Come on, again, go into the quadruped position. Buttocks on a heel, and stretch and look up. Keep your shoulder as relaxed as possible. Do not try to elevate it. Keep it as relaxed as possible. Okay? And again, buttocks on the heels and go back. 2, 3, 4, 5, 3 more reps to go. 2 more. This exercise is going to help you to open all that facet joints of your lower lumbar as well as the upper thorax and neck. Good job. There we have finished our first exercise as a warm-up. For the second exercise, I want you guys to stand up and we are going to do some of the hip mobility work there, okay? The second exercise for the warm-up is called as hip in and out. Before we actually jump into the exercise, this is called as pelvis, okay? Now, there are our hip joints attached to something called as acetabulum, and this is our femur, okay? Now, what happens whenever we are moving our hips around? Now, there are 2-3 rotations that happen at our hip. There's external rotation, there's an internal rotation movement. So, for this exercise, we're going to more focus on understanding how is our hip moving initially. Is there a mobility restrictions that you are feeling for yourself? So feel free in case if there's some bit of balance issues which comes while you do exercise, you can even take a little bit of wall support and do it, okay? So for the beginners, it is better to take a wall support. If you think you have a good balance, feel free to just do it without any support, okay? So for starting this exercise, this is going to work again on a hip mobility. So your hands here. Now also imagine that when you're doing this exercise, there are 2 laser lights that have been fit on your hip, okay? Now laser will always point in front, okay? That is what you have to always remember. When you're doing this exercise, do not try to over move your hip joint away or spine rotate, okay? So the laser lights will always point in front. Always remember that, okay? So for the starting position, have your feet a little wider so that you're a shoulder width apart. You're going to keep your hand here first, okay? Let's do it on the right side. So the weight bearing leg is going to be in the left. Shift your weight completely on the left side. Make sure your feet is properly planted, okay? And you're going to raise your hip like that, okay? I'm just going to show you a side angle so that you can see it better, okay? So somewhere around 90 degree. So your hips and knees and point the toe down is 90 degree, okay? Now you're going to move it out. Again, I'm going to show you with this angle again. So you're going to keep it this way. You can keep your hand here and just move it out, okay? And in. Good job. There you go. 1, out and in. 3, and in. What I want you guys to avoid in this exercise is rotating like that, okay? Rotating or pivoting against this hip and rotating your spine. Keep doing, keep doing. Come on, come on, come on. Do not stop in between. Okay, you rotate and come back. You take the hip out and in, and out and in. One more rep, come on. Out and in. Good job. We're going to do it on the opposite side now, okay? Time, weight bearing on the right side. Raise your left. Okay, so raise your left, toe pointing down, do not overdo it. So do not cross that 90 degree angle or do not be here, okay? Just keep it at the 90 degree and do not anterior or posterior tilt your pelvis. Just keep it as neutral as possible. Take your one hand here and then you're going to push it out. Okay, now you're not going to rotate this way, okay? That's a mistake that has to be avoided. Okay, so just going to keep it here, roll it out like that and run. Always remember, the laser lights that are fitted in your hip joint will always point in the front. There you go. 3, come back. 4, come back. Good job. Keep doing, guys. 4 more reps to go. Come on. 5, 6, 7, 8. Relax. That was our warm up. 1 set, 8 reps on both sides for hip and out and in. Hopefully, you might feel a little bit of, pinching sensation in your hips initially, but that's completely fine, which will go away with over a period of time and you will get used to the movements. And obviously, you're going to improve your balance too for this exercise. Okay, let's start with our third warm up for today's session. That is going to be very, very easy, a pelvic tilts, okay, which we have done and understood what is it in the last session itself. We are quickly going to do that just to get that quick mobility in our pelvic and the lumbar area. Okay, so let's go. Again, your feet has to be hip width apart. Okay, hands here. Now go for that anterior pelvic tilt. Squeeze the buttocks and go for the posterior pelvic tilt. Okay, I'm going to show, I'm not going to keep my hands here. I'm going to keep it here, but you guys can just keep it here. I'm just keeping my hands here so that you can see the pelvic movement properly and understand, okay, how it is done. So this is your pelvis. You take it in an anterior tilt. You might feel that your tummy's belly is protruding out, and that's completely fine. Now your posterior tilt and get that squeeze in your buttocks. Good job. Again, an anterior tilt and a posterior tilt. Good job. 4. And squeeze the buttocks when you come back. Stay as erect as possible through your posture. Do not slouch like this, okay? I want you to stand. Activate your upper back muscles and rhomboids. Do not stand like this. Have an energy. Have an energetic morning. Come on. Let's do it. And a posterior tilt. Keep doing it. We will have 5 more reps of this. Anterior. Squeeze that buttocks when you go in a posterior tilt. Do not slouch. Stand erect. 4, 3, 2, squeeze the buttocks, and 1. Squeeze the buttocks. Good job, guys. Hopefully you're all warm up through your hips and buttocks, because the exercises we are going to do today, again, we are going to do it for the posterior chain, mainly for your glutes and hams. So I think you guys need a 10-second break. Take a 10-second break, sip some water, feel free to just lie down and do some diaphragmatic breathing. Upcoming exercises are going to crash, okay? Okay, let's start with the first exercise for today's session, that is called as hip hinge. First thing that you guys should know is hip hinge is not an exercise in itself. Hip hinge is a movement that I'm going to teach you for this session. Now, this hip hinge exercise or a movement pattern, you're going to learn that and incorporate that hip hinge in the exercises that are going to come for the further sessions. Be very mindful, be very attentive when I'm teaching you hip hinge, because this is a very, very basic movement. You might not understand it on the day one, but keep practicing and trust me, you'll get better with this, okay? So this is not an exercise in itself. This is a movement, okay? Again, for the hip hinge to start with, you're gonna equalize the weight on your body, on the foot. Again, hip width apart. I'm just gonna go on a side angle so you can see me better. Your hands are going to be here. For the hip hinge, things to avoid: do not go in the anterior tilt. Do not excessively squeeze the buttocks and go into posterior tilt. Do not slouch there. Stand as erect as possible. Keep your chin tucked in. Keep your rhomboids activated. Do not go in that anterior tilt. Just maintain a neutral spine, which we have learned in our first session. Okay? So keep that core active and tight while you do the hip hinge. The hip hinge movement is a very easy movement where I want you to push your hips back, okay? So this is the movement. So you're not going to do a anterior tilt and go this way, or you're not going to, protrude your chest in front. That's not the movement. The movement is very easy. Equalize weight distribution on your foot, okay? Stand erect, keep your hands here, no anterior tilt, go in a neutral spine, soften your knees a bit, and there you go. You just push your hips back. You might have a tendency to fall back like that. Take a good support, okay, in case if you're a beginner. Okay, that's completely fine. Okay, so you're going to soften. Take your hips back, hips back, hips back, hips back, hips back, hips back, and squeeze the buttocks and come up. Now that's the hip hinge movement. For the beginners, if you're finding it very difficult, I would suggest to do it near a wall, okay? So just stand near a wall like this, and imagine that somebody is pulling your hips from behind, or you are going to touch your hips on the wall, okay? So just stand here, Give yourself some feedback. Feel free to just keep your two fingers or the palm here and just press on the hip, touch the buttocks, and come back. Touch the buttocks and come back. Okay? Let's do. Come on. We are going to do 8 reps and just one set of this movement for us to understand it better. Let's go. 1. And squeeze the buttocks and come up. 2. And come up. 3. Come up. Do not again tilt from there. Do not slouch from here. Keep your posture erect. Good job. 4. 5. Squeeze the buttocks while you come up. 6. 7. 8. Good job. There we have finished first movement of our today's session called as hip hinge. Now the next exercise is using the hip hinge. We are going to do something called as RDL, that is a Romanian deadlift. Sounds like the exercise name seems like it's quite complicated, but trust me, once you get a hack of it, it's going to be easy. I'm going to tell you some do's and don'ts. Please follow through properly. In an RDL, we do the same movement as hip hinge. The only thing is we're going to go a little more deeper and your hands are going to be on the side. Again, to start the exercise, have your feet hip width apart. Okay, hands are going to be here. Some do's and don'ts are: do not anteriorly or posteriorly tilt. Maintain a neutral spine. Keep your core active. Hands here. Start with a hip hinge movement. Okay, let's do first set 8 reps. Okay, so hands here. Slowly slide your hands back throughout your anterior thigh and go down. Bend your knees till 30-degree. Make sure that your shin are aligned and then squeeze the buttock and come up. Okay, so this movement generally we get confused between a squat. Okay, so it's the angle of the knee is going to be constant, somewhere around 30 degrees, and then you're going to squeeze the buttocks and come back. Okay, let's start with our first rep. Okay, hands here. Push your hip back, push your hip back. That's your 1 and come up. 2. Good job. Squeeze the buttocks and come back. Do not anteriorly tilt there. Do not protrude your chest a lot. Okay, just stay erect. Another more important thing for this exercise is do not keep looking up like this. Okay, because then your chin is actually like looking up and then the load will go on the neck, which we don't want. So align it, chin tuck, and then go. Hopefully we are on the 6th rep. And up. 7 and up. 8 and up. Good job. We have one more set of 8 reps. Come on. Move around a bit. And let's do the second set for this exercise, RDL. Hands on the side again. Keep your spine completely aligned. Core tucked in. Feel your glutes when you're coming back, okay? So you go down like that. Do not do your chin like this. Keep it all aligned. Push your hips back. Push your hips back. Hopefully you're feeling a little bit on your glutes. So squeeze your buttocks and come back up. 2. Squeeze the buttocks and come back up. Good job. 3. Squeeze the buttocks and come back. 4. Plant your feet properly. Do not raise your great toes from the floor. Plant your feet properly. 5. 6. 7. 8. Good job. Squeeze the buttocks and feel it on your glutes. Good job. There we have done our second exercise for the session that is called as an RDL. Feel free to take just a 10-second break, do some diaphragmatic breathing, sip some water, wipe off that sweat. Okay? And we'll soon start the third exercise. Okay? So let's start with the next exercise. It's going to be in a lying down position. I want you guys to grab a pillow. So where's my pillow? Oh, there is my flying pillow. Cool. Let's start with the exercise. So the next exercise that we do is called a clamshell exercise. Again, where you should feel the exercise. Should feel the exercise absolutely here, okay? Which is called as a gluteus medius muscle. Again, a very, very good lateral stabilizers of your hip, as well as a very important muscle when it comes to a posterior chain, okay? For this exercise, I want you guys to lie down, take your pillow. Let's lie down on one side. We're going to do it on both sides. Okay, so lie down on one side. Make sure you're doing this near a wall. In case for the beginners, I would generally suggest to do it near a wall so that your spine is stabilized against it and your body is not trying to do a lot of compensatory movements like, moving your pelvis or not stabilizing your lower lumbar area. Okay, so your head touching the wall, your palms are going to be, one hand is just going to be outstretched like this. Your both the buttocks are touching the wall completely. Okay, and you bend your knees approximately to somewhere around 90. Okay, and then the one hand is going to be here, both buttocks touching the wall. Now, the exercise name is clamshell, which itself shows that you're just going to open like a shell. Okay, so you're going to open your knee like that. Keep one hand here so that you are getting some feedbacks from the back. Okay, I want you guys to bend the knees properly. Okay, heel on heel. So your heels are your best friend. They're not going to leave each other, they're going to be on top of each other. Okay, let's do 2, 3, 4, 5, 6. Do not hold your breath, keep that core active. 8, 9, 10. Good job. Hopefully you felt it in here. Okay, switch the side. Just move on the opposite side. We're going to do it on the opposite this time. Okay, so you're going to sleep on your right shoulder, head touching the wall, your heels touching the wall, your buttocks and the whole spine stabilized against the wall. Okay, hand is going to be here and you're going to open up. 1, feel that mobility as well as a bit of shakiness on your hip joint in case if you're a beginner in doing this exercise. Might also feel a lot of burning sensation on the side of your hip, which is completely normal and expected. I think we are on a 6th rep. 7, 8, 9, 10. Good job. Let's do one more set. Come on. Do not stop there. It's going to be a little difficult session, guys. Come on. Let's do on the opposite. 10 more reps. Let's go. 1. Feel that burn. 2, 3, 4. No breaks. Okay. Keep doing that. 6, 7, 8. 2 more. Come on. 9, 10. Good job. We have one more set on the opposite side. No cheating, no breaks. Keep doing the exercises, okay? This time on the right, heel on a heel, buttocks touching the wall. Feel that glute burn on the side of your hip joint, okay? 2, 3, 4. Keep the core active. Keep the lower lumbar stable. 7, 8, 9, 10. Good job. I think in case if you're feeling a lot of burn there, you should give yourself a clap. Okay, so we have 2 more exercises left. Probably I don't need a pillow for that, so I'm going to throw it off. Okay, so let's do the next exercise. Before we go, we have 2 more exercises. We're going to do something called as a hands bridge. You should feel the exercise on your hamstring. Okay, so this is called a proximal part of hamstring, and this is a distal part of hamstring. Depending on how your muscle alignment or how tight it is, you might feel the exercise in either of these areas, just back of your thigh. Again, for this exercise, lie down on your back. You don't actually need a pillow for this. Okay, so you're going to look up, hands on the side. Bend your knees initially. Now, what I want you to do is very, very important in this exercise is to not lose that core. Keep it all tucked in, a posterior tilt, smash that balloon there, which we had understood in the last session. Okay, so keep that balloon smashed there. Now, for the starting position of this exercise, I want you to go on your heels like that. Not on the foot, it's on the heels. And you're going to slide your heels a bit to somewhere around, let's say, 60. Okay, so there you go. Now, the tendency of your lumbar spine to arch is going to increase. But you need to activate that core, press that, smash that balloon which is there. Okay, just under your lumbar spine. Hands on the side. Now, press your heel on the mat, squeeze the buttocks and go up, lift up. 1. Keep counting, guys. I'm going to tell you some do's and don'ts while you're doing the exercise. Okay, keep pressing the heel, go up, keep that core activated. Make sure you're not overdoing it, okay? So the hips, knee, and shoulders in one line is something that we tend to achieve or we intend to achieve for, okay? You don't want to go and overarch there, or you don't want to fall that anterior tilt there. You're going to just tuck in properly and then go for the reps, okay? Keep doing it. I think 4 reps are done. Tuck in. 5, 6, 7, and 8. Good job. We have 1 more set. Hopefully, everybody is feeling on the hands. In case if you have any queries or doubts in today's session, feel free to drop it in our comment section and I'm going to answer all of it. Okay? Let's do 1 more set, 8 reps, hams bridge. Okay? I'm going to show you from this angle just for you to understand that whenever you're doing a hamstring bridge, you're not supposed to take your knees inside, okay? The tendency of your knees falling inside when you're doing a hams bridge is more. So try to avoid that. Let's do 1 more set. Come on, come on, come on. Lie down. Keep your core active. Go into that position on the heels, somewhere around 60. Tuck in, squeeze the buttocks, push that heel inside the mat and squeeze and go up. 1. Slowly come down. And 2. Slowly come down. Keep pressing that heel down. Feel your hamstring burning. 3, 4, 5, 6, 7, 1 more, 8. Good one. Going to give you a short break of 10 seconds. Feel free to just stretch your arms, stretch your feet. Do some diaphragmatic breathing. Lie down there for a 10-second. Bend your knees. Keep 1 hand here, 1 hand here. Just try to breathe in and breathe out. Just do 5 reps of this. Get that oxygen because we have 1 more last exercise left, okay? Sip some water too if you want. Okay, all set for the last exercise for the day, which is going to be core activations with the heel slide. We have done core activation in our last session, but today we are going to go to the next level. Okay, pretty easy. You're going to go lie down on your back with your knees bent. Okay, hands on the side. Imagine that I've kept a tray. Okay, now in that tray, I have put a lot of marbles. Now, the aim that should be in your head is that the let the marbles be on the tray in as center as possible. Do not let the marbles go or roll on the right or roll on the left while you're doing this. So just imagine you have to align the marbles in as much as possible in the center of the tray. Okay, keep your hands on the side. Do that tuck in movement. Do not lose that tuck in. Keep the balloon smashed throughout the exercise. Okay, hands on the side. Go on the heels. Keep that balloon smashed and core activated. Slide your one heel down. Go slow and come back. Two. Again. Good job. There you go. Two. Now, once you're going away, your tendency of your anterior pelvic tilt might increase. So try to tuck in there. Do not let that happen because then the load is going to go on your lumbar spine, which we don't want. We want you to feel on the core. That's four, five. One more mistake that I want you guys to avoid is to not lift your leg. You just have to slide your heel and come back. Let's do one more. Eight, and come back. Good job. Now relax. Tuck in again. Take it on the left hip now. Okay. So you're going to slide your left heel. So there you go. One, and come back. Keep it tucked in. Do not lose that anterior core activation. Don't go in anterior till like that, okay? Just tuck in properly and go. Four. Slide it slowly. Do not rush when you're doing this exercise. Do it really mindfully. Do it really mindfully, okay? If you rush in this exercise, it's not going to give you a lot of benefits. Do it mindfully. Make sure that you're sliding your heels, the marbles on the tray are in the center. At the same time, you're not losing the core, so you're keeping the core active. There you go. And then you relax. Okay. So 8 reps on this exercise, one set for the day is enough. I want you to do a lot of practice at home also for getting better on this exercise. Quickly, as a cool down, we're just going to do a diaphragmatic breathing exercise. Be in this position. Keep one hand on the epigastric region. Keep one hand on the upper chest region. For the people who have missed my first session, please don't worry. I'm going to quickly teach you the diaphragmatic breathing again. Okay? So one hand here, one hand on the upper chest. Relax your shoulders as much as possible. Feel free to just close your eyes and feel each breath that you're taking inside and then exhaling it out through your mouth. So when you're breathing in, I want you to breathe in with your nose, fill that air in your tummy properly, breathe out with your mouth and relax. Okay? Give me 5 breaths, and that's going to be a cool down for today's session. Breathe in. Hold there for 2 seconds, breathe out. Breathe in. Feel free to close your eyes and do that. It's going to help to improve the blood circulation, cool down your body. You might have lost a lot of oxygen and your muscles must be craving it. So this is going to replenish all that oxygen in your body. And breathe out. Breathe in and out. One more. Breathe in. Breathe out with your mouth. Relax there. Good job. Good one. So here we have successfully finished our second session of this program called as Back on Track. For a quick revision, what we have done in today's session has that we have mainly in the warm up, we have focused on a bit of mobility. Coming towards the exercises of this session, we have considered and worked more on our glutes and hams. Okay, specifically a glute medius also through a clamshell exercise. Okay, for listing down the exercises, or if you have any doubt, I have listed it all in the description box. In case if you have any doubt, please feel free to just put it in the comment box and I'm going to answer the questions right now for you. Let me just go and check if there's any question. Okay, I think there are a few questions. Let me just take a few of them. Okay, so on my screen, I can see that there's a question popping. When and so basically the question is how to not hold the breath when you're doing the core activation and how to understand it better. Now, initially, you might have a tendency of holding a breath when you're doing a core activation and filling all that air into your tummy and feeling that air pressure. But with practice, you have to try to avoid it. Okay. So, the best thing that you can do is activate your core. Keep your two fingers exactly where to feel the transverse abdominis. Okay. So, basically, what you can do is when you're in the lying down position, there is something called as ASIS, anterior superior iliac spine. You can just keep your hands just beside it or inside it and try to do a cuff movement, okay? So when you cuff it, you might feel a little bit of, contraction of the transverse abdominis muscle. Now, this contraction is supposed to be felt when you're doing a core activation. So no way you're going to hold your breath and create that air pressure there. You should be able to feel the contraction of a transverse abdominis muscle when you're doing a core activation. Also, try taking a normal breathe in and breathe out. A quick thing that I can suggest you guys is to just do a core activation and probably just sing your favorite song because then you know that you're not holding your breath. As I'm activating the core, I'm actually talking to you all. So, which means I'm not holding my breath. So, this is the way you can actually practice and get better and understand how is your body understanding the core activations. Okay. Hope I have solved that doubt. In case if it is still a little bit of confusion, please feel free to just drop it in the comment box again. We are done with today's session. See you all in the next one. Bye bye. Have a good day.